Hey guys, I'm Dr. Forrest with Allen Spine and Sport. I'm going to show an end range knee movement that's really important for several parts of a larger clinical picture. But if we don't have what's called terminal extension of the knee, don't think of it as hyperextension, but your knee needs to get to at least neutral or 0 degrees of flexion or extension. And a lot of times that becomes limited, either previous injury, surgery, scar tissue in there, or just the nature of we do so much sitting throughout the day and bending and lifting and things like that we tend to lose that terminal extension because of muscle tightness and shortness and limitations in joint mobility. So how we do it is, I'm going to show the right one here. You'll put all your weight on your right leg, leaning up against the wall. There's 3 parts to this. 1, you're going to lock out your knee. 2, you're going to contract your quad. And you can actually just start with those 2 for a set of like 10 to 15 or so, holding for a second or 2. And then after we do a little bit of that, depending on whether it's a few sets of it or even like a few days of just that movement, then you're going to lock out, contract your quad, and use your hands to just provide a little bit of overpressure into further extension. This kind of seems like you're trying to hyperextend your knee, but you're not. It's very safe. Obviously, I'll probably taught you this in the office. So it's a very safe movement. We don't want to apply too much pressure, but just a little bit of overpressure. And then one part sometimes we add to this depending on, again, what I've recommended to you. So don't start with this next movement. We typically start with this first movement that I just showed, but sometimes we will take the foot and point the toes out to provide external rotation of the knee. And the same thing, you're gonna lock out your knee, contract your quad, start with just a few sets of that or a couple days of it, and then you're gonna lock out, contract, and provide a little bit of overpressure. So thanks for watching and have a great rest of the day.